Dr. Georges Benjamin is Executive Director of the American Public Health Association. He joins us now for more insight. Dr. Benjamin, welcome back to the show. First of all, how is the J&J vaccine different in the way it was developed and how it'll be used?
Well, the fact that it's going to be one shot and that it's really an adenovirus that is, a kind of old technology, I think give people a lot of comfort that there's going to be a vaccine that's going to be readily accepted by many people.
And the fact that it is, as you referred to it, the old style of vaccine technology, the fact that it's been developed this quickly is rather remarkable.
Well, not really. If you think about the fact that we just had extraordinary use and understanding of this science for many, many years, this is the same kind of technology that we've really done for the flu virus and some of our other vaccines. So the fact that this technology has been around for many years, many of the scientists involved have lots of confidence that it was going to work.
How will the Johnson & Johnson vaccine enter the mix of existing vaccines? Will it go to specific places, specific populations?
Well, the CDC, when they do their prioritization next week, I'm assuming they'll do this Monday or Tuesday, they will give us the idea of who's actually the priority populations to get vaccinated. But I think that most states will simply use this vaccine to get to the populations that have been the hardest to get to. And I think that's going to be very, very helpful because the fact that it's one shot makes it easy for people who can only get off work on a particular day, or you can actually take it into communities because it doesn't, require ultra cold storage. You can be put into a freezer or any kind of refrigerator, and that really makes it much more accessible for like rural communities, for example.
Absolutely. Given the efficacy numbers that they are lower than the mRNA-based Pfizer and Moderna, but still significantly high for Johnson & Johnson. But given the numbers, should people be thinking about a booster shot later?
Well, Johnson & Johnson is looking at whether or not there's going to be a need for a second shot. Those studies will not be done until around July. But quite frankly, this vaccine, even with the one shot, looks pretty successful. And I got to tell you, I don't think there's much of a difference. If I was going to get vaccinated today, I'd be very comfortable getting the J&J vaccine.
We have seen a bit of a relaxing of attitudes amid the increase in vaccinations in terms of COVID protocol among the general population. How significant of a concern is that?
That's a big concern, and we are seeing that. And I'm encouraging people, let's not take our foot off the pedal too quickly. Let's slow up, think about what we're going to do, continue to wear your mask, wash your hands, keep your distance, don't get in large crowds. And let's not reopen our nation too quickly, because if we get a big rebound, we're going to get not only more infections, but we can get those variants to spread as well.
Are there things other places, other countries are doing better that as you watch this globally, you think, I wish we were doing that here?
I think the U.S. is doing this quite well now. Finally, we're right on target. We've got a single unified national voice. We're scaling up. We're helping the countries make more vaccine. So I'm pretty pleased with what the United States is doing right now. Now, you have some great places like Israel has done a really good job on getting their population vaccinated. But, this isn't a race. The idea is for everyone to get everyone vaccinated. And so I think we're in that race right now.
Dr. Georges Benjamin from the American Public Health Association, thank you for joining us.
Thank you.